Meerman,
Here.
Tisdall,
Here.
Beerline,
Here.
DeBoer,
Here.
Preston,
Yep.
Schmaltz,
Here.
St. Germain,
Here.
Bohnak,
Here.
Frisbee,
Here.
Witset, Carter, Whitworth,
Here.
Neely, Hoskins, Foreman. Mr. Chair, you have 11 members present. You do have a quorum.
Excuse me. Representative Tisdale moves to adopt the minutes of the June 25th meeting. There being no objection, the motion passes. Today we're going to take up voting on House Bill 4484, 4509, and 4591. We have a couple people that are stuck in traffic, and we do have some testimony, so we're going to go directly. Oops, I got the wrong mic. Oops. Sorry about that. Apologize, everybody. We're going to take up 4591 for testimony real quick, and then we'll move into the votes after the testimony. Madam Clerk, do we have Kate Dawson is on Zoom wishing to speak? We believe. Hey, Kate, how are you?
Oh, fine, thank you.
Well,
Good
good.
morning.
The
Thank
testimony
you, Chair,
floor is all
Van der
yours.
Waal. Whoops. Can you hear me okay?
We can.
Okay. My name is Kate Dahlstrom. I'm the president of NAMI Grand Traverse. NAMI is National Alliance on Mental Illness. So I'm up here in Traverse City. Thank you for giving me a little bit of time to testify about House Bill 4591. The first thing I would like to say is I'm not an expert. I've been involved with NAMI for many years, but I'm not a therapist. But I did read the testimony that was provided to you by the president of the Michigan Mental Health Counselors Association. And I think that would be Mr. DeBoer, was right on point with his recommendations, and especially to thoroughly evaluate the impact before passing 4591. At first glance, I thought this is great. I can see how it's very well intentioned, but I do believe that there will be unintended consequences. And mainly, I think that's the result of Michigan's very poor Medicaid reimbursement rates. I tried to find some good analyses of Michigan versus compared to other states. I found a few, and I just want to quote what I found, but I really urge you to ask the department, that being the Michigan Department of Health and Human Services, to provide to you a better comparison. What I found for a 60-minute individual psychotherapy session, which is billed as CPT 90837, Michigan, the average reimbursement rate is about $68, whereas Massachusetts is $125, Colorado $134, Ohio $115. And why that's relevant is that it very well could happen if this House bill passes the way I believe it's worded, is that our Michigan therapists will start providing more out-of-state psych visits. And we actually will have an exodus of provider time here in Michigan. We've known, and I think most of you probably have heard, anecdotally, that Michigan has some of the lowest reimbursement rates in the country. And when we saw, I think it was Meridian and another provider, reduced reimbursements for Medicaid patients, that up here we saw many therapists stop seeing Medicaid patients or just go to cash payments. And the providers that we do have who still see Medicaid patients, and one is Pine Rest has an outpatient only clinic up here. They operate barely in the black and sometimes in the red, but they still see Medicaid patients. They don't have to do that. And my fear is that we will lose more therapist time to other states because they can get sometimes twice the rate of reimbursement that they would receive here. So I encourage you take a little more time with this bill and to consider trying to increase or require these managed care providers like Meridian, McLaren, and the others. I think McLaren maybe does a good job. Look at what they're reimbursing to therapists, and let's make some changes there. Blue Cross Blue Shield of Michigan, a nonprofit, CEO took home, I think in 24, $17 million. Is there someone who could do that job making even half that amount? I totally believe there's several someones who could do that. We need to make sure that our managed care providers are reimbursing at comparable rates before we, pass this bill. So that's, I guess, all I have to say this morning. Thank you for hearing me.
Kate, thank you. We have a couple questions. We'll start with Representative Meerman.
Thank you, Chair. Could, leaving aside the discussion about our reimbursement rate in Michigan, could this also be looked at as a potential revenue stream for a counselor who's located in Michigan and wants to stay in Michigan, but is considering, maybe I need to leave Michigan in order to, feed my family? This might say to them, you can stay here, make more money in some other states, and still provide counseling here in Michigan. Otherwise, my choice is to leave Michigan altogether in order to get the higher rate.
I suppose that would be possible, but that's looking at, the therapists. How are they going to sustain their family? So what they're doing, though, what's happening, though, is if they are providing services in other states, we're losing service, and we already do not have nearly enough therapists here in Michigan. There was a bill in the last session that would alter the licensure examination for social workers and make it, not everyone's a good test taker, right? I think that bill made a lot of sense. We know we need to increase the number of therapists, and yes, we do need to make sure that they can, feed their families, and we could do that through our managed care providers reimbursing at rates comparable to other states. So I guess yes to your point, but I don't think it would accomplish what we really need to accomplish.
Thank you. Any other questions from the committee? Representative Preston?
Yeah, just a question regarding how this would leverage manpower in an area that the UP is dramatically short. I think putting up these artificial barriers and trying to corral people into staying in the state of Michigan, when in the UP we already have a shortage, it's beyond comparison, and we could actually leverage a lot of these healthcare professionals in Wisconsin to be able to work across the border freely, because we just don't have the manpower to keep up with what's going on. And a bill like this would be transformational for the UP, which is a border peninsula all the way across the line with Wisconsin. And it looks like Wisconsin's already enrolled in this right now. And so, the UP stands to benefit greatly from something like this.
Well, but what would be the incentive for a therapist in Wisconsin to provide services with getting half the reimbursement when most other states are also short of therapists? I think there's a better way to get more therapists. Provide incentives for therapists to live and provide services in Wisconsin. Not only that, but there's a big provider, multi-state provider called Charlie Health, and they provide individual services. They provide PHP, which is partial hospitalization, IOP, intensive outpatient, and they do that all online. But you know what? They provide for Michigan too, and they could provide for the UP for commercial insurance. They will not provide for Michigan Medicaid patients. They will provide for Medicaid patients in other states. So really, the underlying problem is our Medicaid reimbursement and our shortage of therapists, but all states are experiencing that. And if I was a therapist in Wisconsin and I was only going to get half of what I normally make, and I'm already super busy, why would I provide those services? I just think there's a better way, or we need to modify this bill in such a way. And we don't want to provide a Wisconsin therapist more than we do a Michigan therapist, right? So that wouldn't work. That would really alienate our Michigan therapists. So I think the underlying problem is our Medicaid reimbursement rates are far too low, and a lot of that is our managed care providers. And we need to, we can increase the number of therapists by providing incentives to live, even for 2 or 3 years, give them a tuition break, and okay, you can get this break in tuition, but you need to serve in the Upper Peninsula for 2 or 3 years, and then if you keep rotating the classes or the groups that graduate to do that, I mean, those kinds of things work in other areas. Why not, here, and why not for mental health therapy?
Yeah, you're talking about financial as being primary motive, though, and I have a tremendous amount of counselors up in my neck of the woods that work for ADAPT in the Wisconsin side, as well as some of the CMHs on the UP side, and their biggest barrier is barrier to entry to the state. They'd love to provide continuity of care across state lines, and right now they just simply can't. This compact paves the way for that. So finance isn't always the motive on everything. A lot of people just want to help their communities, and there's a lot of communities that are shared communities across state lines throughout the UP.
Thank you, Representative. Representative Carter.
Thank you, Mr. Chair. I will continue to be deeply concerned with the looming cuts to Medicaid. And you brought this up, you mentioned the fact that this could impact the Medicaid performance, particularly in our low-income communities. My question to you is, how much of this cost is shared, how much does this cost for states to join this and remain in this compact? In other words, how much does it cost to get in the compact, and then how much does it cost to remain? Because the bottom line is making sure that our constituents are taken care of. Do you understand what I'm asking?
You know what I would ask for the compact, who's ever leading the compact or overseeing it, to provide you with reimbursement rates from the other states in the compact, and you could specifically point out billable services like the 60-minute individual psychotherapy, CPT 90837, and look at, if you see, it's really hard to find comparable reimbursement rates for Medicaid, but the department should be able to do that, and this compact should be able to do that. I guess I really would take caution in passing this bill the way it's currently written, or do it as a pilot project or something, because if we see an exodus of our therapy time for our Michiganders, that's not the result we want to get. And I strongly encourage you to look at, modifying the social worker licensure exam and make it, other states are doing it differently, and we do need to, look at what other states are doing. But anyway, yes, please proceed with caution. I would try to get a little more data from the other states and reimbursement rates and things before I move forward. But this is on you guys. So any way I can help, and anytime, I'm more than happy to do that.
Representative Carter, follow up.
Thank you very much. I do belong to the National Council of Insurance Legislators that look at model legislation across all states, and I do plan to take this to them to see just the overall impact, because I can understand the advantage of having the compacts, but I want to make sure that there's no unintended consequences, particularly to the people that we need to serve, by passing something without doing our due diligence. Thank you, Mr. Chair.
Thank you. Representative Thompson.
Thank you, Mr. Chair. Thank you for your testimony. You talk a lot about reimbursement rates. Correct me if I'm wrong, but doesn't the Department of Health and Human Services set those reimbursement rates?
Well, so this is something I'm totally not an expert in, and I need to take a whole class, right, on the financial structure and reimbursements of managed care plans. And so they definitely do for the CMHs, the community mental health, and they use, I think it's Meerman, the actuary, to tell them what the rate is. But now I think for managed care plans, and this is something you guys need to find out more about, is that McLaren, they put out the quotes in McLaren, Meridian, and some of these others, then decide their own rates, because I'm pretty sure like 2 or 3 years ago, Meridian on their own decided they were going to reimburse therapists less. And so, see, this is just one of the things I think you
Let me-
need to
let me
know,
just
and I would
pause you
love to
for-
know
like, I'm so
myself
sorry.
more about.
Let me
Hold
just
on
pause
one
you
moment.
for
Go ahead,
one
Representative
moment.
Thompson.
So it is my understanding that the health plans are actually willing to increase their reimbursement rates. Would the department allow them to? So my last question, a final question, is your organization working with the DHHS appropriations chair so that we can get those reimbursement rates higher so that the health plans can pay them, which it's my understanding that they are going to?
We are not, NAMI is not working with them currently, and we do a lot of things, but and would like to do more, but we are mainly volunteer run. We have some contract workers, but no, so we're not, but I'd be more than happy to join any task force or whatever is in place to try to, work that out.
Thank you.
Thank you. Thank you, Representative. Couple other questions. One, first off, when Representative Carter asked about cost, there is some minor costs that would come to the state in adopting the compact and what potentially comes around that. It's minimal. I have one other statement, and I guess it goes directly to you, and I'll have to pull it back up in my email, but I had a young lady reach out to me and said how imperative that the compacts be passed. She wants to remain in the she wants to work in the state of Michigan, however, does not live currently in the state of Michigan, but wants to and not try to have a separate license to come into the state, and wants to have her current license universal from where she lives so that she could cross state lines and work where she desires to without uprooting her family. I think sometimes we get a little worried and we overreact because we don't want the potential cost or what reimbursement rate. Right now we're not going to disagree that there's a crisis, but I think if we don't address allowing people to make a choice of where they come to work, it could be more of a harm to the state of Michigan than blocking that potential, because I don't necessarily agree that they're going to always want to leave. I think we have a lot of people that come on. I think Northern Michigan's a perfect example. We have people that come in and live in our communities for 5 months out of the year, but can't practice even though they're practicing in an adjoining state. So I hear your concerns. I think that we'll take that into our thought process as we move forward on these bills. Do we have anybody else? Any other questions from the committee? I don't see any. Thank you for your time today. I appreciate you being here
You're welcome.
and being willing to do that.
Thank you for having me.
You're welcome. Nobody else? Okay. All right. Very good. That's all the testimony we have. We're going to move in now to voting. And we're going to start with House Bill 4484. And I'm going to read in a few cards. We have Taylor Elpert, Michigan Health and Hospital, not wishing to speak in support of the bill. 4484, not wishing to speak in support, Alex Cisak, Memorial Healthcare. 4484, not wishing to speak, Kelly Pierce, neutral on the bill, Michigan Speech, Language, and Hearing Association. Those are the cards we have on 4484. Representative Thompson moves to report House Bill 4484 with recommendation it be referred to the Committee on Rules. Clerk, would you please take the roll?
On the motion to refer, Chair Vanderwall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdale,
Yes.
Bierlein,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witsit, Carter,
Yes.
Whitwer,
Yes.
Neely, Hoskins,
Yes.
Foreman.
Yes.
Mr. Chair, you have 15 yeas, 0 nays, 0 pass. The motion prevails.
House Bill 4484 is referred to Committee on Rules. Now Representative Tisdale moves to report House Bill 4509 with recommendation. It be referred to the Committee on Rules. We have a few cards to read in. Not wishing to speak in support, Kelly Pierce, Michigan speech. Taylor Elpert, not wishing to speak in support, MHA. Not wishing to speak in support, Christine Shear, Michigan Association of Health Plans. Not wishing to speak in support, Alice Seasock, Memorial Healthcare. And that's it on that. With that, Madam Clerk, would you please call the roll?
On the motion to refer, Chair Vanderwall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdale,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witset, Carter,
Yes.
Whitwer,
Yes.
Neely, Hoskins,
Yes.
Foreman.
Yes.
Mr. Chair, you have 15 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Madam Clerk. House Bill 4509 is referred to Committee on Rules. Next up, we have House Bill 4591. We already heard testimony. I have a couple cards to read in. Not wishing to speak in support, Elizabeth Cutter, Michigan Health and Hospital Association. Not wishing to speak in support, Christopher DeBoer, Michigan Mental Health Counselors Association. And not wishing to speak in support, Alex Seasock, Memorial Healthcare. With that, Madam Clerk, could you please call the roll? Oh, I am sorry. Representative DeBoer moves to report House Bill. Thank you for correcting me.
On the motion to refer, Chair Vanderwall,
Yes.
Representatives Thompson,
Yes.
Meerman,
Yes.
Tisdale,
Yes.
Beerline,
Yes.
DeBoer,
Yes.
Preston,
Yes.
Schmaltz,
Yes.
St. Germain,
Yes.
Bohnak,
Yes.
Frisbee,
Yes.
Witset, Carter,
Pass.
Whitwer,
Pass.
Neely, Hoskins,
Pass.
Foreman.
Pass.
Mr. Chair, you have 11 yea, 0 nay, 4 pass. The motion prevails.
Thank you, Madam Clerk. House Bill 4591 is referred to rules. Seeing no other business, Representative Preston moves to excuse absent members. There being no objection, the motion prevails. There being no further business before the Committee on Health Policy will stand adjourned.